Today, we're going to be talking about HIV, or Human Immunodeficiency Virus. As you can tell by the name, it is a virus. This virus attacks CD4 T cells in the human body. When HIV attacks these cells, the body cannot react to new threats coming into the body. HIV doesn't just appear in the body, it has to enter from an outside source. An individual can contract HIV through the exchange of bodily fluids such as blood, semen, and vaginal fluid. This can happen through unprotected sex, blood transfusions, sharing needles, and during pregnancy and breastfeeding. The symptoms that are associated with HIV are broken up into two categories, acute and symptomatic. Acute symptoms develop a month or two after the virus enters the body. The virus goes into a somewhat dormant stage where there are usually no specific signs or symptoms. The virus remains in the body in this stage for around 10 years, then develops into the symptomatic stage. Having HIV can take a toll on one's body and leave them susceptible for contracting a host of other diseases and cancers. The virus leaves the immune system weak and almost defenseless from other viral or bacterial infections. If HIV remains in the body for too long without treatment, it can develop into AIDS, which is when the body's CD4 T cell count falls below 200. Once a person has AIDS, their quality of life significantly drops. They are also very susceptible to any disease. Individuals can even die due to complications with illness and weakened immune system. Currently, there is no cure for AIDS. However, there are treatments for HIV, and in some cases it can be cured. Some of the treatments include NRTIs, NNRTIs, protease inhibitors, entry inhibitors, and integrase inhibitors. Some of these work by preventing the virus from turning RNA into DNA, and some others work by preventing the virus from entering the cell. To find out if one has HIV, it is important to get tested. Testing can be administered at hospitals, medical clinics, substance abuse programs, and community health centers. There are even take-home tests available for purchase. There are 3 different types of tests used to determine an HIV infection. There are antibody tests, antigen/antibody tests, and nucleic acid tests. As much as testing is important, it is even more important to try to prevent from contracting the virus in the first place. These practices include using protection when having sex, limiting sexual partners, and using sterile equipment. There are also drugs available for prevention of HIV. PrEP is an anti-HIV drug to be taken as soon as possible after potential exposure, and PrEP is a prevention drug to be taken to lower the risk of getting HIV. Within this country, there is a great demographic disparity of people living with HIV.